Hello guys, good morning everyone. So are you ready for today's discussion? So today's discussion is lens quiz that happened yesterday at 6 p.m. So we have 10 questions lens quiz discussion. Are people joining us so that we can start? Yeah? Alright, so we'll start with the first question. Am I audible to everyone? Are you able to hear me well? Please confirm that for me. Alright, laser used to manage after cataract. Okay, laser used to manage after cataract. So first of all, what is after cataract? After cataract is your posterior capsular opacification, PCO. Okay, so PCO that occurs after cataract surgery, which usually occurs 1 to 3 months later, sometimes even a year later, but definitely it takes a month to occur. And how does it present? It presents just like cataract. So that is why we call it after cataract. Just like cataract means a slow, progressive, painless decrease in vision. Okay, so that is after cataract or posterior capsular opacification. And how do you manage it? The treatment of choice. The treatment of choice is you make an opening using a laser. Yeah. Where do we make an opening? On the posterior capsule of the lens. So we call it posterior capsulotomy. And what is that laser that we use? We use ND-YAG laser. Okay, neodymium, yttrium, aluminum, garnet. ND is neodymium, YAG, yttrium, aluminum, garnet. Okay, ND-YAG laser. So that is what it is. So option A, argon green, no. Argon green we use for photocoagulation like in retina. ND-YAG is the answer. Excimer laser we use it for LASIK procedure for stromal ablation. Double frequency ND-YAG, again a photocoagulative laser which we use for retinal lasers, retinal photocoagulation. So the answer here is ND-YAG laser posterior capsulotomy. Alright. Okay, question number 2. Hamarlopia may be experienced by a patient with. See, hamarlopia means day blindness. So when the patient goes out in a bright light like this, so the patient is literally blinded. Why is it? So when you go out in bright light, what happens to the pupil? The pupil is going to constrict. It's going to be in a myosed condition. So anything that is in the way, so anything in the visual axis, any opacity, whether it's a corneal opacity or a lenticular opacity, anything that is going to be in the visual axis, and especially when the constricted is pupil, the visual axis becomes very, very narrowed, right? So if it's going to block, that is going to cause day blindness. So the patient sees better at night time, but his vision drastically drops when he is out in the bright light. So that is hamarlopia, opposite of nyctalopia. So options: cupuliform cataract, cuneiform cataract, nuclear cataract, punctate cataract. See, cupuliform cataract is a central saucer-shaped cataract in the posterior cortex. So this is your posterior cortex. When you see from the front, it's a circular area. So in the center there is a saucer. So cupuliform, yes, can, and it's quite dense. Okay, can cause hamarlopia. Let's see the other options as well. Cuneiform. See, cuneiform cataract is a peripheral wedge close to the equator of the lens. It's quite in the periphery. So that is unlikely to cause hamarlopia. Nuclear cataract. Now some of you get confused. Ma'am, nucleus is in the center. Yes, nucleus is located in the center, but it is not that dense to cause a hamarlopia itself. Overall the vision will be decreased, but there is no difference between the day vision and the night vision as much. Okay. Punctate cataract. See, punctate cataract, small fine dots and mostly in the periphery. So again, it's not blocking the central axis. So what is that which can cause a hamarlopia? Cupuliform cataract. Okay. So even your posterior subcapsular cataract can cause hamarlopia because again, it's like a central plaque. Yeah. Although it is quite diffuse under the posterior capsule, the central portion overlying the visual axis, it's quite dense like a plaque. So that can also cause hamarlopia. Okay. So patient will give you a typical history that they can see better at night time. Towards the dusk, they can see better. Okay, next question. Lens is an embryological derivative of. See, lens is a surface ectodermal derivative. Please remember that. All the 3 L's are surface ectodermal derivatives. What are the 3 L's? Lacrimal apparatus, that means your lacrimal gland, your lacrimal sac and the entire drainage system, surface ectoderm. the lens, and also the eyelids and the glands, the lids and the glands. All the 3 L's are surface ectodermal derivatives. Yes, what are the 3 L's? 1, lacrimal apparatus, then number 2, the lens, and number 3, lids and glands. And also we have the conjunctival epithelium and corneal epithelium. Okay, so totally 5 structures from the eye which are surface ectodermal derivatives. Okay, so now we'll go to the next question. A 55-year-old executive with history of type 2 diabetes. Okay, so a 55-year-old guy, type 2 diabetic, is diagnosed of significant nuclear sclerosis. He wishes to resume his office activities at the earliest. Of course, you know, when you suggest cataract surgery for this patient, the first thing is going to ask us is, when can I get back to work? Because, you know, none of us want a loss of pay. Even with pay or without pay, you don't get leave, you don't get chutti. So he says, I want to go back to work soon. Must be a workaholic, no? Or he just loves his work. Which of the following procedures would you advise for this patient? Of course, a cataract surgery. So which, okay, given the circumstance and his demand, which one? FLACS, FLACS, that is femtosecond laser assisted cataract surgery, ICC, intracapsular cataract extraction, ECC, extracapsular cataract extraction, SICS, small incision cataract surgery. So what does the examiner want to ask you? The examiner wants to ask you which has the fastest, the quickest visual rehabilitation. Which cataract surgery has the quickest visual rehabilitation? Anything between phacoemulsification and FLACS, both of them have the quickest. Okay, phacoemulsification and FLACS. So FLACS is femtosecond laser assisted. So you're kind of breaking up the nucleus with using the femtosecond laser. Phaco is ultrasound energy. That's the only difference. All right. So whether it is, see the options, it is FLACS or phaco. Here we don't have phaco, FLACS. So great. So FLACS would be the answer. Okay, femtosecond laser assisted cataract surgery. You can advise to this patient and tell them you can go to work almost immediately, right? The equatorial diameter of lens, see the shape of the lens, as you all know, is biconvex. Now biconvex is when you see from the lens from the side. When you see from the side, it is biconvex like this. Anterior and a posterior little more convex. But when you see from the front, it's circular. So circle has a diameter, yes. So the equatorial diameter. Okay, so equator means normally we say this is a equator, but in the lens this is the equator. So the diameter of the equator. So the diameter of the equator normal. Let's see the options: 12 millimeter, 9 millimeter, 6 millimeter, 5 millimeter. See the normal range is 8.8 to 9.2 millimeter. The normal range of equatorial diameter is 8.8 to 9.2. So we have an option 9 millimeter, which would be the best option. Okay, so 9 millimeter. Then a 55-year-old patient presents with redness and sudden decrease in vision 1 month after cataract surgery. What is the most likely diagnosis? So he's undergone cataract surgery. A month later, there's a sudden decrease in vision. Yes, there is redness also. They've not mentioned about pain though. Anyway, TAS. Toxic anterior segment syndrome. TASS stands for toxic anterior segment syndrome. Okay. Now TAS presents within 12 hours or maximum 24 hours after cataract surgery. So now in our history is 1 month. So TAS is ruled out. Okay. Option B. P. acnes, propionibacterium acnes, endophthalmitis. Option C. After cataract. Option D. Staph epidermidis endophthalmitis. Definitely not after cataract, because you remember the first question we discussed. After cataract is a slow, progressive, painless decrease in vision. It's a slow decrease in vision. But here there is sudden decrease and also redness. See, after cataract we don't have redness at all. Yeah, PCO we don't have redness. So that is also ruled out. So now between propionibacterium acnes and staph epidermidis, that is where you will have to choose it from. So look at this time frame. It says a month. Okay, so when we talk about early onset endophthalmitis and delayed endophthalmitis, the cutoff is standard textbooks quote 4 weeks, some books say 6 weeks. So if you take the 6 weeks cutoff, so your staph epidermidis falls within that, right? And our question says 4 weeks after cataract surgery, patient presents with sudden redness and sudden decrease in vision. So it is definitely an end of, would be painful, and it would be a staph epidermidis endophthalmitis. Okay. Next question is very, very easy. Anterior lenticonus. Anterior lenticonus is seen in, I told you always take the A, take the L, AL, quote it, Alport syndrome. Anterior lenticonus you get in Alport syndrome. Is that clear? Alport syndrome. Alport syndrome also has kidney problems. The kid, usually a child will have microhematuria because of the kidney issues and can have sensory neural hearing loss. Okay, sensory neural hearing loss. Next question, type of cataract seen in Fuchs uveitis syndrome. You know, madam likes Fuchs uveitis syndrome. So, remember the previous discussion we talked about one patient presenting unilateral cataract and all that. Yes. So, it is a cataract, complicated cataract. Fuchs uveitis, obviously any uveitis causing a cataract would be a complicated cataract. And most often that complicated cataract is a posterior subcapsular cataract. Yeah. So, the options were posterior subcapsular, anterior subcapsular, posterior polar, anterior polar. So, the answer is posterior subcapsular cataract, right? Okay, next question. What is the direction of displacement of lens in case of ectopia lentis in Weil-Marchesani syndrome? I told you, remember, ectopia lentis means displacement of lens. So, direction of displacement in Weil-Marchesani, when you march forward. Yeah, we march forward. So, anterior displacement of lens. Yes, anterior displacement, and very often that anteriorly displaced lens will sink down. So, you have an anterior and inferior displacement of lens. So, what are the options here? Posterior, inferonasal, anterior, superotemporal. So, it would be anterior. Where do you get inferonasal displacement, bache? Where do you get inferonasal displacement of lens? Yes, in homocystinuria. Very good. And where do you get superotemporal displacement? Superotemporal you will get in Marfan syndrome. So, in Weil-Marchesani, it is an anterior and inferior displacement. In Marfan's, it's superotemporal. In inferonasal displacement in case of homocystinuria. Cystine, okay. Cystine you have Cystine. IN is a inferonasal displacement. Okay, we are there almost over. Last question. The dye used to stain anterior capsule of lens. Why would you stain the anterior capsule of lens? For a better contrast, better visibility. For which step? For your anterior capsulotomy. Okay. So, mostly when we are doing this CCC, continuous curvilinear capsulorhexis, or as a beginner when you were doing can opener technique. Yes, so when you don't have the contrast, the thread reflex is not enough to do CCC. So, then we stain the anterior capsule using what dye? The blue dye. Yes, the blue dye, which is trypan blue. Okay, so trypan blue dye is used to stain the anterior capsule. For which step of cataract surgery? For anterior capsulotomy. So, generally there are two types. There are very many types, but most commonly done. One is a can opener technique, but now we all progress to a CCC, that is continuous curvilinear capsulorhexis. Alright, so any doubts in this lens quiz? And today evening 6 p.m. we're going to have the UVA quiz on the Telegram group, and tomorrow I will see you at 11 a.m. on the dot with the UVA quiz discussion. And if you want to join the test and discussion series, there are 3 batches actually. So, one is a NEETPG batch, another is an INICET batch. So, the INICET batch finishes first. Finishes on May, you get access until May 17th or actually till 18th. And the NEETPG, till whenever the NEETPG date is announced, you will have access that batch. And yeah, we also have the PD set. So, PD set until March or April whenever your exam dates are announced. So, the PD set batch is there. Alright. Yes, you can please join our test and discussion series, okay, on the EyeMentor app. Yes, Strawberry, yes, you can join the test and discussion series on the EyeMentor app. So, we have 3 quizzes, 3 tests a week, 20 questions, okay. So, you can join that, you will learn a lot more, alright, and you can watch the discussion on the EyeMentor app. So, you can use the link to get in touch with us and join the batch on the EyeMentor app, or you can directly download the EyeMentor app and you can DM us there as well. So, we'll give you the details and you can join the batch. And the New Year discount is also on. So, you can use the 20% discount. Alright guys, I'll see you tomorrow at 11. Bye-bye.